Welcome. My name is Caroline Masbunji, and I'm part of the global GBVIMS technical team. This resource is available both as podcast and video short. This episode on supervision and staff care is part of a series on case management in the context of COVID-19 pandemic. For the full series, check out our website at www.gbvims.com. Monitoring the quality of your care and case management services is an ethical obligation. There are three main ways that you can monitor the quality of your case management services: client feedback surveys, case file audits, and ongoing supervision of caseworkers. However, in the context of the COVID-19 response, supervisors are unlikely to be physically present where caseworkers are providing services. Therefore, supervision for case management will need to be adapted to be provided remotely. When shifting service provision to remote case management over the phone, organizations should review their case management SOPs to include regular remote supervision of caseworkers. Supervisors should plan for regular individual and/or group sessions. Group supervision could be organized through online platforms such as WhatsApp, Skype, or Zoom. Prioritizing group sessions could serve the purpose of peer-to-peer sessions that can help supporting caseworkers to cope with the new modalities of service delivery. Supervision tools mentioned in the case management guidelines, such as the survivor-centered attitude scale, case management knowledge assessment, and the case management quality checklist, could be adapted by supervisors to meet the needs of the new modalities for service delivery. It is recommended to ensure regular scheduled sessions for supervision to give a sense of normalcy to caseworkers. For high-risk cases, organizations should consider a fast-track process to reach out to supervisors. This could be done through WhatsApp. If Primero GBVIMS Plus is rolled out, supervisors can conduct remote case files review by using functionalities built in the system, such as custom export, case plan and case closure approval, and flags. For more information on how to provide remote case management services over the phone, check out our episode, Taking a Crisis Call, What to Say and How to Say It, as part of our series. In the context of the COVID-19 pandemic, supervisors will have to resort to strategies to provide remote supervision. These are few of the strategies that they can use. First, use technology for communication. Because in-person contact between remote staff and supervisors is limited, interaction is commonly facilitated via mobile phone and technologies such as Skype, Viber, and WhatsApp. If phone-based case management is conducted, all staff should have been issued an agency phone, which is preferable than using their personal phone. Therefore, they should be able to communicate with supervisors. Supervisors should perform weekly check-in with all remotely located direct reports to offer at least a minimum level of support and guidance. If discussing cases via phone, staff and supervisors should be clear that survivors' identifying information should not be shared. Second, use online case management systems to review case management files. Reviewing case files on a regular basis can help determine whether forms are being used and filled out properly, and can help assess the quality of services being provided. The use of online information systems such as Primero GBVIMS Plus can facilitate supervisor case file review with appropriate restrictions for confidentiality, allowing supervisors to remotely observe the case management process. Supervisors can set up a schedule for review of a randomly selected number of files from each caseworker, or from a few caseworkers, or review 2 files per caseworker per week. Supervisors should make notes of any particular challenge a caseworker is having with case documentation. or a common challenge that emerges among files across the team. Feedback on trends in case file review should be regularly shared with the caseworkers. Supervisors and caseworkers should use software flagging function, one-on-one discussions, and group calls to discuss such feedback. Case file reviews are just one part of supervision and should be complemented by other supervision methods. Third, use technology to support remote capacity building. Organizations can consider written, visual, and audio skill enhancement tools for remote capacity building. Mobile application for capacity building can be developed or used for offline. Remote Offered Skill Building Application, or ROSA, is a new application the IRC developed to facilitate skill assessments and capacity building for frontline workers, and create a community space for peer learning and coaching. It utilizes knowledge and skills assessment outlined in the Interagency GBV case management guidelines. The application can support caseworkers and community focal points knowledge of GBV and strengthens case management, communication, and survivor-centered attitudes and skills. By downloading the app on a mobile device, tablet, or smartphone in advance, users can access content in a setting with low or no connectivity. Providing case management services over the phone in the context of the COVID-19 pandemic, where survivors have little option and access to care, can be particularly challenging. Caseworkers can feel powerless towards GBV survivors. This is added to a situation at home that can be challenging for caseworkers to deal with, in addition to general fears linked to the pandemic. It is essential that organizations include staff care consideration that can be implemented remotely. Supervisors are encouraged to establish daily contact with caseworkers to discuss experience and stressors, encourage them to actively reach out for support, and connect them to psychosocial support and mental health professionals. Staff care tools can be discussed between caseworkers and supervisors, such as the self-care inventory available in the case management guidelines training material. Supervisors can help establish a support network across caseworkers. For example, they can create WhatsApp groups to monitor daily well-being of all staff. Despite urgency, supervisors should keep regular schedules for check-ins with staff to ensure their well-being. In addition, in-person supervision of hotlines requires that supervisors be available for emergency checkup, conduct debrief calls with hotline staff, establish a regular supervision time every week for staff and supervisors to check in, conduct periodic training and ghost calls to monitor how services are provided, provide emotional support to staff given the potentially upsetting nature of the calls. This can take the form of shorter shifts on the hotline, regular supervisory session, and temporary task shifting and/or individual psychosocial support to prevent burnout. Establishing boundaries for caseworkers when providing case management services from home can be particularly challenging. Survivors, especially when hotlines are in place, might call at any times of the day and night, putting pressure on caseworkers to respond. Caseworkers might find it particularly challenging to disconnect and focus on other things to support their well-being. It is important that supervisors take time prior to shifting service delivery from remote phone-based case management to discuss with caseworkers. They need to understand, are caseworkers comfortable providing case management services over the phone from their homes? What are their living conditions? Do they have to take care of children without help or limited help? to the extent possible and upon the willingness of the caseworkers to share that information. Can you understand what are the dynamics at the homes of caseworkers? What resources caseworkers have to support their well-being? In addition, there should be clear guidelines on the availability of caseworkers over the phone, especially when hotlines are used. Supervisors should establish schedule to allow caseworkers to take breaks and disconnect. In all cases, supervisors should inform caseworkers that they have the right to withdraw if they feel uncomfortable. This should be written in organizations' policies. A right to withdraw policy provides staff the permission and support to make decisions based on their own safety and well-being, without cause for retaliation practices. This policy should be communicated to all relevant actors. Thank you for listening to us today. To find out more about the series on case management in the context of COVID-19 pandemic, check out our website. As always, be responsible with your data and learn more at gbvims.com.